As we all know, the United States has now reported more than 250,000 deaths from COVID-19, 250,000 deaths. That's 19% of the total COVID deaths worldwide. We are number one in this category. This comes 9 months after the first U.S. fatality from the virus in early February. COVID deaths have increased by 42% over the last 4 weeks, a pace not seen since mid-August. The number of new infections also continues to climb at an alarming rate. The 7-day average for new cases is now more than 171,000. Joining us now, Director of the Center for Infectious Disease Research and Policy and a professor in the medical school at the University of Minnesota, Dr. Michael Osterholm. He's a member of President-elect Biden's Coronavirus Advisory Board. And Dr. Osterholm, I first want to ask you where we stand as opposed to the peaks we were reaching in New York City and major cities back in May. It seems like this disease, this virus has spread out across the country, and the situation might even be worse now.
You know, Mika, I wish I could give you a better answer other than to say that we're going to look back in the next few weeks and wish we were only back at 170,000 cases per day. That's what America has to understand we're confronting. That's what our hospitals are going to have to take care of. And that's why we have to convince the American public that we must do so much more to reduce transmission.
What can the Trump team do to help the Biden transition team be in a strong place to fight this virus?
Well, right now, it would be ideal, although I realize the challenges of hoping that there is no party label. We're all coming together on this. Governors and mayors need help out here badly right now, trying to understand what the most effective things they can do. We need a financial package right now that makes it possible for us to shut down some small businesses, such as bars and restaurants, that helps those unemployed to do the right thing. They want to do the right thing, but when you're financially so challenged as we are right now, this makes it harder to do the kinds of things we need to do. So we need help from Washington, and it should be a nonpartisan public health crisis response.
Doctor, what are the greatest challenges we face in the coming weeks? Where should we be focused?
Right now, we have to understand that we have the opportunity to get to, you might say, the promised land. I think these vaccines are going to be very important and very effective. But we're not going to have them for weeks, in some cases, for some people, months. But we do have light at the end of the tunnel. So please just dig in one more time and help us. The key factor right now, Joe, is just don't swap air. It's that simple. When people are all getting together in public places, public events, weddings, funerals, school-related events, all these kinds of things that people just don't think of, well, it can't happen here. It is happening. And that's what we need to get people to understand, that if you're in the same room with somebody you don't know and you don't have your mask on, or even in some cases with your mask on, you're at risk. How do you limit that transmission? That's what we've got to do now.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.